Mr. Murali is having almost 7 years of working experiences in physiotherapy services. He is also very much in an active rehabilitation specialist with skills of training for both musculoskeletal and neurological disorders. Currently, he is outlining and structuring to develop a physiotherapist's role in planning and managing workers' health in the benefits of better functional performance at all levels of a working organization. So without delay, let me welcome Mr. Murali Dharan for today's webinar. Thank you, sir. You can start now. Mr. Murali, can you hear me?
Okay, now can you hear me? Hello?
Yes.
Okay,
Yes.
okay, I think just now I have some technical issue. Okay, thanks a lot, Madam Vinothini, and good day, and thanks for participating for today's webinar. So today I'm just going to talk about a general understanding of pain from a physiotherapy perspective. So before we go further, what is pain? Let me get, okay, what is pain? According to International Association study of pain, it is unpleasant sensation and emotional experience with or without actual or potential physical damages. So we understand that the pain is not just from physical effect, but mainly effects from cognition and further emotional responses. So why is so crucial to manage pain? It is because pain is one of the main factor that affecting functional performance, restricting social participation, troubling and causing poor quality of life, and of course, constantly increasing cost to manage pain, particularly chronic type of disorders. So as a physiotherapist, we have a few important roles in dealing or managing pain. Firstly, we do an early identification of type and nature of pain. Secondly, we plan a structured and effective mode to therapeutic based pain management. And thirdly, of course, we do an early identification or detection of potential red or yellow flag for further referral for medical examination or intervention. So before I go on with today's content, let's see some of our normal misconceptions of pain. Generally, we used to label pain as bad. So when the moment we label it bad, we already create a negative behavior or negative thought about the pain. But what's about the early benefits of pain that trying to tell us for further protection and prevention? Secondly, we tend to use the same type of approach for all the pain. So generally, whenever you have pain, we tend to go for cold, hot, ointment or massage. It's not I'm saying it's wrong, but are we really are we really applying those pain management according to the presentation of pain that we are feeling? And are we checking enough what the indication and contraindication for each type of pain management therapy that we are using at the daily life? So that's something that we need to ponder. Then another general thought that movement will exacerbate pain. So whenever you have pain, you will decide to rest and don't move much in order to believe that it will boost the healing process and it won't cause further injuries or aggravation of symptoms. It's okay for short term, but what's the impact is going to happen when you continuously proceed with this belief. Okay. Then for it's more to physical. Still, some of us believe that pain is just physical, and by some short-term therapy like medication or just by cold or hot, it will be resolved. But what about the involvement of cognition and emotional response towards the pain? And lastly, grin and bear it. This is quite common, where whenever we have discomfort or early symptom of pain, we try to bear it and we try to perform any activities in order of thought that the pain will go away. Yeah, it is true at some circumstances, pain will go away, but are we thinking what are damages that we are giving to the particular structure and what are the long-term effect is going to be? So I hope for today's webinar, I can cover some of these misconceptions and we can have a better understanding of pain and in order to find the best tool for treatment. So today, overall, I'm going to describe type of pain. What are the physio basic assessment we do for the pain? So from the finding, how we implicate into the physiotherapy practices, right? Since pain is analyzed in nervous system, so let me go through or do a brief about nervous system. Nervous system consists of central nervous system and peripheral nervous system. Central nervous system consists of brain and spinal cord. The main function of brain of central nervous system is for managing body and mind. The peripheral nervous system responsible for communicating between our body parts. It could be external and internal body parts with the central nervous system for further response and action or analysis. If you further dissect the spinal cord, you will see there are two types of materials, gray matter and white matter. Gray matter usually where the interneuron and modulation take place. The white matter where all the ascending and descending pathways is formed, which I will discuss further later. Under peripheral nerves, in peripheral nervous system, there are two types of neurons. Firstly, sensory neuron. The function of sensory neuron to receive sensory input from different type of receptors. So here I've highlighted few type of receptors. For example, proprioceptors. Proprioceptors usually made of A alpha large diameter myelated fibers. Touch and pressure is made of A beta moderate diameter and myelated fiber. Temperature and pain made of small diameter myelated A delta and also from a C nerve fiber where it is known as unmyelated. So what's the difference between myelated and the size of the fibers? Let me compare with myelated and non-myelated first. Whatever myelated, it will the function of myelation is increase the nerve impulse within the nervous system. So those myelated will send a fast the nerve impulse compared with unmyelated, where usually the impulse will be slower. Compared with the size of the diameter, the larger diameter will produce large volume or amount of nerve impulse within the nervous system, right? So there's another type of neuron from the peripheral nerves, which is known as motor neuron. The function of motor neuron is send the response or action out towards usually on muscles. It could be skeletal muscles or smooth muscles, and of course to the glands for further response and action. So let me explain a general response that usually happens when we face any trigger factor. For example, in this case, when we touch something sharp, it could be sharp or hot or anything trigger, it will be detected by the receptors and the nerve will be brought by a sensory neuron and it get modulated at the spinal cord level and a fast reaction will be produced out to the muscles to withdraw it from danger. So this is the normal reaction known as withdrawal reflex take place. However, the another response will be sent to the brain if the impulse is insignificant, it just perceived as pain. But if there is a significant damage happen, there will be a significant impulse will send to the brain. So then further action, planning, and response will be taken place from the higher level. Okay. So there are three major factors that influencing pain. The first factor, known as biological factor, consists of nociceptive, nociplastic, neuropathic. Nociceptive usually a mechanism that happens when there's an injury to the body parts. It could be skin, muscles, tendon, tissue, or joint capsule, or ligament, and so on. Neuropathic usually a mechanism where there's a direct lesion or injury to the nerve itself. And thirdly, nociplastic, where happen due to central sensitization and usually involve lesion in the central nervous system. And second major system that involved in pain is motor system. And a primary factor that always cause or contributing to pain could be acute or chronic is psychosocial factor. Let's go through what is nociceptive mechanism. As I explained before, when there is a triggering factor, withdrawal reflex will be initiated, where the sensory neuron will be detected and a fast reaction will be given out to the motor for the withdrawal reflex. However, if there's a significant damage happens, it will trigger immune responses where it causes accumulation of inflammatory mediators around the structure. The purpose is mainly for protection and healing of the particular tissue. So when there's a high amount of inflammatory mediators produced, a process known as peripheral sensitization will take place. It means the stimulus will open up, I'll call it door, a more door for the pain to receive. So once it's detected, let's say around 5 or 10 doors for the pain to receive, the door will be open. And the painful stimulus will travel all the way to the spinal cord level. And here, the same level of pain will be opened. Let's say here, like 5 or 10 doors, or here the same level of 5 or 10 doors be opened. And the further painful stimulus will go all the way to the brain, higher level, through ascending nociceptive pathways. Ascending means is going up. So when reached here at a higher level, there are two process or response take place. One at a higher level and second at the brainstem. Okay, first let me discuss about the response from the higher level. So once the pain stimulus reach, cortex 1 of the place get activated in both motor and sensory part. In motor part, it will analyze what type of pain, and if necessary, it will give out the motor response for protection or temporary spasm. And secondly, sensory part will be activated where the intensity of pain will be decided, and the level of danger will be determined at this level. And also there will be integration between the motor and sensory place will take place over there. Secondly, at the lymphatic system is mainly the main function of is for emotional and motivation. Here, an emotional response will be triggered towards the pain. So then we will be aware, consciously aware the type of the pain that we are feeling. At the hypothalamus, usually an autonomic response will be triggered. It usually increases the circulation to the affected area, so then the healing process can take place properly. And also it sends some impulses for pain inhibition, which I will discuss shortly. Amygdala part, where is usually for or it trigger flight and fight response. Usually it means fear avoidance. So when this is activated, we will have a basic and natural fear avoidance character where we try to reduce movement around the injured area to protect the structure, and we want the healing process to happen without any disturbance. So these are the normal triggering or response take place for short period of time. But if this is elongated, that's where central sensitization or central or chronic issues will take into place. And second response is from descending pain inhibition, here where a natural painkiller or pain inhibition will be stimulated. We bring all the way to the affected spinal cord area. So here there's two processes. One, the amount of painkiller we try to neutralize with the painful stimulus in order to reduce the painful stimulus. Second, it will try to close down. Let's say here, 10 doors open for the painful stimulus. It tried to close down maybe 3 or 4 of its door. So then less pain stimulus are continuously carried by a higher level. So that's why most of us, when we have trauma, the starting days or starting hours, we feel intense pain, sharp pain, but followed by reduction of pain, because there's a natural way our body or central nervous system balance it and response it and reduce the amount of the pain. So when this is happen in short period of time and usually known as acute pain, after the injury healed, the doors be closed, and very minimal or no painful stimuli will travel to the brain, and all these higher level responses come back to normal. But if this is persists with a negative thought or negative behavior or fail to protect the injured structure, then it will be prolonged and carry on with subacute or possible of chronic disorders. So secondly, let's see about the neuropathic mechanism. Here, unlike nociceptive, there will be a direct injury or lesion to the nerve fiber itself. So here they are, for example, let me show this picture. So let's say there's this herniation. If you observe here, this impinge the nerve, where there are two types of mechanism we stimulated. One, it will stimulate the nociceptive mechanism, as what I explained before. And secondly, due to the injury of the nerve, it causes ectopic discharges. It means where there will be disturbance of normal nerve impulses towards the central nervous system. So that's why sometimes we have the combination of nociceptive and neuropathic pain symptoms. So let me go back to here. When you have both mechanism together, the level of stimulus will be double at least. So high level of pain stimulus compared with nociceptive will be traveled to the spinal cord level, and here more channels or more doors will be open, because there's a lot of imbalance nerve is traveling to the central to the spinal cord, and due to the interruption of the ions, it causes hypersensitivity. So all this will make the central nervous system, the spinal cord respond by opening more channels to deal it fast. And then the large amount of stimulus will travel to the brain. Now, the intensity of cognitive emotional response will be even higher than nociceptive mechanism. So now the brain try to respond even more aggressive or more intensely. So from here, we will have some disturbance in our cognition level. Probably we will feel more high pain intensity by sensory level, our emotional will be more triggered, and the flight and fight reaction will be more intense. Or maybe we'll have more fear in avoidance of movement. So since there's a high level involvement of um, higher level, this type of neuropathic mechanism easily can proceed to chronic type of pain. So as I explained before, when there is a disturbance at the higher level, obviously there will be a interruption in the production of natural painkiller or pain inhibition. So here it will fail to partially fail to neutralize the painful stimulus, and also partially fail to close the actively opened channel at the spinal cord. So this does continuously increase high level of painful stimulus, and the cycle keep continuous. That's why even neuropathic type of mechanism, we have to identify as early as possible by involving the cognitive and emotional approach to deal it as fast as possible before it turns into a chronic type of pain. Uh, so this one I have showed before. So now let's go with the nociceptive part. So nociceptive part where there's a maladaptive or lesion or changes happen within the central nervous system. It could be in spinal cord level or higher level. So what's happening here? Usually the contributing factor is from previous uncontrolled factor. Remember when I explained about nociceptive and neuropathic, when it's a normal reaction for the brain to respond, but if you don't deal at early stage itself, it can promote from chronicity. So when we don't deal both nociceptive or neuropathic properly, there will be abnormal amount of impulses will keep open the channels towards the ascending pathway. So also when there's a mix of injuries like nociceptive and neuropathic, or there's a constant re-injury. So all these actually will keep activate um, the area of spinal cord, what we know we will call a central sensitization. So here there will be even more doors or channels be open. Probably now is 50 or 60 channels open, and it remains active, and it doesn't happen in 1 or 2 months. This process takes at least 6 or more than 1 year for the central sensation to be very highly active. So it come to a point where there's no any nociceptive or neuropathic injuries, we still have pain even by a touch, because this area will be highly sensitive, as is shown by this picture. The stimulus be highly active and high level of painful stimulus. So this will be sent continuously to the higher level, and because of continuous trigger to the cognitive and emotional process, there will be a maladaptive or known as plasticity. Plasticity means long-term changes that happen in the higher level. So when there is a plasticity happen, it will be more on long-term or permanent. That's why in chronic type of pain, it's very important we involve with a lot of biopsychosocial approaches to deal from here first before we go to the physical part, right? So I hope you understand the type of nociceptive, neuropathic, and nociplastic. Let me focus more on the changes from the chronic, from the nociplastic mechanism. So as I explained before, there are 3 major parts that influence for the pain. First part is cortex, consists of motor and sensory. Usually it responsible more on cognitive control of pain. The sensory be more on detecting the intensity of the pain, and also do a multi-sensory integration. When there is a maladaptive happening or there's a long-term triggering factor, will cause altered higher level pain processes. And secondly, the emotional part, where usually where it's important, this Olympic part, where it's usually responsible for emotional value or motivation. Same, when there's a continuous trigger for prolong of time, it will try to adapt, and it causes a chronic type of process, causing maladaptive pain-related emotion and behavior. Then lastly, of course, the brainstem, where the natural painkiller or pain inhibition is produced due to the affected of these processes. There will be a dysfunctional of descending control of pain. It further continuously increase the pain stimulus to the higher level. So these are general differences between nociceptic, neuropathic, and nociplastic. So I don't want to go through the mechanisms as I have explained quite in detail. I just want to rectify the type of pain that nociceptive present is usually sharp, localized, sometimes stinging, dull, ache, and dropping. Neuropathic present usually of more to radiating, burning pain, also sometimes can cause of numbness. Nociplastic usually generalized, sometimes sharp if there's a presence of neuropathic or nociceptive, but generally it will be more general dull ache pain, and usually is non-specific. It usually is not due to specific damages or injuries. The second main factor that influence pain is motor system. Motor system is very important in coordinating movement function. So there are three type of structures that involve in making the motor system work effectively. First, the soft tissue compartment, where consists of ligament and joint capsule, where it gives a primary stability to the joint and also give input of the movement at the joint level. Secondly, muscular action. It gives a secondary stability to the joint and also main function of executing movement. And third, neuromuscular control. This is where a coordination between soft tissue and muscular happens at the central nervous system. So why these three systems work optimally or work together? It is because to give a smooth, low impact, and more coordinated movement. But however, these usually get challenged and cause tissue adaptation. So this type of motor system challenge usually happens when you are into work-related tasks, when you need to work at prolong of time, either in prolonged sitting or standing or do more repetitive movements and so on. So there are two major factors involved in tissue adaptation or tissue challenges. First, as I explained before, cumulative load, which receive impacted by repetitive movement, where you need to do a particular work task in more repetitive way, causing more challenge to the soft tissues and muscles. And second, sustained alignment, for example, prolonged sitting or prolonged standing, where we give a lot of load and challenge the tissues or muscles to adapt. Secondly, psychosocial factors. This is where the personal characteristic come, where we'll have a poor understanding of perception of the discomfort that we feel at the early, and also poor in handling the pain symptoms at the early stage itself. And secondly, of course, the activity demands. When you are at the workplace, for example, you have some tasks to do, and usually you have to perform it in an excessive way, in which further increase the burden and tissue adaptation. So in the process of tissue adaptation, usually it starts from the slack range, when we give the challenge, is start to adapt, and there will be a physiological changes happen within the tissue to be more elastic and will be more apt to receive loads from these two components. But when this is persists for a longer period of time without an early intervention or early recognition or early fix or management, so the particular tissue will lose its mechanical properties and turn into a plastics stage. So in plastics stage cause hypermobility of joint, in which cause very poor stability. And to avoid this or to protect this, two systems will compensate, muscular system and motor control system. So the muscle, as I explained before, it gives a secondary stability to the joint. Now this muscle will try to get more stiffer or get spasm around the effect around the tissue that getting plastic, to give more support to the tissue so that it doesn't go for failure. And also motor control, where now the brain will focus more on controlling the stability of the joint rather than other smooth or low impact movement. So when these two compensated, that's where we start have early discomfort or early level of pain, or sometimes we have acute pain where we always neglect. And when we continuously neglect, the microtrauma from the plastic will turn into a microtrauma when a total failure of soft tissue happens. When microtrauma take place, is very likely, if we don't identify or if you don't do anything about it or manage it well, it will turn into a chronic symptoms where there's a lot of involvement of cognition and emotional disabilities, as I explained under nociplastic. Right, so I think I've covered enough under the motor system. Later on, Madam Vinothini will assist me to explain more in detail about motor system into an industrial environment. Yeah. Followed by a psychosocial factor. Okay, it's quite wide. It's quite wide range, and I try to specify few consequences in the aspect of psychology and social. Under psychological, there are few consequences, primary consequences, like when we have a negative understanding or behavior towards pain perception, when we have a poor skill or knowledge in coping with the pain or any management regarding of it. When we have a pain catastrophizing event where we feel high level of threat without understanding what type of pain it is, we simply get threatened without knowing what type of pain is that. And we have prolonged fear avoidance. As I explained before, it is okay to have early early avoidance for the movement, but when this behavior prolonged, there's more disuse going to happen, there's more muscle deconditioning going to take place, and more disability going to happen than chronicity. Depression, mainly due to because of reduction in functional performance, restriction of social participation, the cost that you need to spend a lot now to manage your pain, and also continuously worsening of quality of life. So all these will cause quite bad depression. And also the previous pain experiences where you already had a past episode of trauma and you already felt how unpleasant it is. So you tend to bring forward to the present without knowing what type of mechanism that you're going through, and the threat and fear avoidance will be continued even more worse than the first episode. The other social consequences are mainly from the work sector, where you have to work according to the demands that you're entitled to, right? So secondly, most of the time when you are working under a poor economic related working environment, and there are most of the places where a good economic setting is already there. But when we have poor understanding and negligence to utilize it, it will cause further issues. So in this aspect, economists and this is one of the aspects where economists and safety officers plays an important role in assisting physiotherapists to plan further for employee or a patient. Disability consequences where a person already have this disabled issue from different conditions, like probably diabetes, neuropathy, or amputee, and so on. Home factors where you already have issue with work, with stress, high load of work, with high reps of work demands, and in addition, home factors where family or personal oriented tasks that you have to continuously deal with. Sedentary lifestyle where it shows that you have a poor physical fitness, which cause you high risk for injuries and pain. Economic factor is where we will be more concerned or focused towards financial stability rather than much emphasis on health and other related environmental factors. So all these consequences actually going to give us three main problems, which is going to cause us with low threshold for pain, where even a little bit of pain we tend to feel is too high, or we usually get hypersensitive with even a small intensity of the pain because the input from here and changes the higher level, and is going to affect our natural system of producing painkiller or pain inhibition, and we will be tend to be more reluctant and negligent, and usually will dependent more to short-term symptom releasing technique, like for example painkillers, medication-wise, and so on, without focusing more on the long-term management. Let's see a general overview of physiotherapy assessment for pain. I'm not going to discuss very in detail, but I just want to show what are aspects that we will assess, right? So for biological component, for physiological, we're going to identify the location of the pain or discomfort, the onset of it, whether it's still in acute, subacute, or already in chronic. That means the duration, how long the pain they felt, the causes of the pain, potential causes of it, if there's any combination of symptom feel with the pain, maybe probably if there's any combination of different type of pain, or pain with numbness, or pain with other issues, and so on. I can't see this. 1 minute. Okay, under sensory part, we'll be checking how intense they feel the pain, the quality of pain, whether it's dull, dropping, radiating, and so on. What the pattern of the pain, whether it's localized or generalized, and so on. How severe and irritable the pain. This is very important for us to structure pain management later to control the severity and irritability of the pain. Then what are the aggravating and easing factors? For example, what are the movements or activities that aggravating the symptom? And what are the movement or activities that easing the symptoms? So this is also a very important aspect. So then we will try to move the patient as early as possible, although they present with some level of pain, by knowing these two factors. Then for okay, for motor part, we'll be checking more on the movement analysis. We start from the accessory, where we'll see the small movements happening within the joints, because the small the accessory movement always uh, reduce the general movement of the joint. So first we check the joint within each joints, or the joints that are related to the pain, and we'll see the gross movement, a general movement of the joint, how the joint is stabilized, both static and dynamic balance of joint or whole body, and functional performance that can be done or cannot be done from the respected place. Then secondly, okay, later. Okay. Okay, secondly, the neuromuscular aspect, where we're checking the power of muscle by strengthening tests, flexibility of muscles, whether the muscle is tight or stiff or already shortened, whether the muscles have poor endurance, which cause easily fatigue, how's the motor control between the stabilizer and mobilizer. In the neurodynamic, we will check whether there's involvement of nerve compartment and other related special tests. So for psychological perspective, there'll be a large component that we will be checking. For example, affective, how's the mood state of the person, how anxiety level, whether he's depressed with the other contributing factor, how his well-being, and so on. So under cognitive, we will check whether he have a basic understanding of the pain that he feel, view of self, how he coping skills towards the pain that he's experiencing, whether he had a previous injury and what type of treatment that he underwent and what's the outcome from it, how his attitude and belief regarding coping up with the pain and other factors that influencing pain. In behavior, more in communication, how's the communication from him, interpersonal interaction, how active he is in physical nature, whether he's mildly active or highly active, or he's in sedentary lifestyle, his pain behaviors, and if he's taking any type of medication to reduce the pain, and a quite deep analysis on the pain to check in different aspects whether his pain disturb his sleep, or if he feel sleep throughout the night, what type of mattress he use, what type of pillow that he use. So we will quite analyze in detail about this. And type of nutrition and hydration, whether he's well hydrated, because it's important for the healing process and current situation of the soft tissues. Then socio-cultural aspect, where we will be more focusing more on family and social life, work nature, environment, home responsibilities, environment factors, and social influences. So end of the day, there are few important information we'll be deriving, mainly the rate to identify whether it falls under red or yellow flag. Red flag mainly on a primary concern of physical derangement. The yellow flags mainly on mental and psychological issues. So secondly, we will be focusing to specify whether it falls under nociceptive, neuropathic, or nociplastic mechanism, or mix of it, or whether it's due to motor or psychosocial factor, or mix any of it. Then determining the stage, whether it's still in acute or subacute and chronic. If it's still in acute, proper management and patient education awareness to be given, so then it doesn't promote to chronic stage. If it's in chronic stage, we'll do a lot of biopsychosocial approaches rather than physical type of management. Then level of function and disability and health, mainly on the checking or restriction of his daily activity and his social participation. With that, we'll do a realistic goal and treatment plan according to highlight these issues. The treatment will be executed, and importantly, we will keep reevaluate whether there's a progression or no progression. If there's no progression or the level is still the same, we will do reassessment, or we will classify him under red or yellow flag for further examination, right? So with all this information, we'll do a implication in physiotherapy practice. So here, I'm not going to talk so much on the physical physiotherapy intervention, but I'm going to specify on basic pain management tools where you can easily adapt or use at home, in which I call a self-rehab techniques, right? So before we go further with that, we need to understand how the pain is controlled by this method. So we usually follow the concept of pain control theory of pain. Gate control theory of pain. So here there are two type of technique that we use: releasing technique and deviation technique. Um, Releasing technique like hot, cold therapy or decompression. So as I explained before, when there's a nociceptive mechanism, there'll be a sign of inflammation, which is swelling, warm, redness, and pain. So A delta is highly sensitive to heat, and C fibers are highly sensitive to the inflammatory mediators in the swelled place. So when we give cold, it will reduce the temperature of the area, and it will cause vasoconstriction of blood vessels. So then less blood circulation will be flow out into the damaged area. So there'll be less activation of A delta and C fibers, less information will go to the brain, and the control system, the natural painkiller, can affect more effectively. A second releasing technique, if there is a compression, we do some technique where release compression, not fully most of time, but to an extent where reduce the impact or the painful stimulus to travel towards the brain and make the natural painkiller works even, or inhibition works even better, right? The second approach, the releasing technique usually short term, but deviation technique more on the long term approach. For example, TENS usually activate is it will give a vibrative muscular stimulation type of current where it activate A delta primarily, and it will the impulse will flow all the way to the brain by blocking the pain sensation. So since it's a bit larger diameter than the pain fibers, the brain feel more of this sensation rather than the pain sensation. So that's how the pain is controlled or blocked from receiving to the higher level. On the other hand, therapeutic exercises will activate the largest fiber, which is A alpha, as I showed here. A alpha, where high volume or high volume with high rate of impulses will send towards the brain, and brain receive more impulse of this activation rather than pain. And it also helps to stimulate the natural painkiller area to inhibit more pain response at a lower level, right? And another deviation technique is the psychological approach, where we usually give an early awareness, education, and ways how to manage them properly. So then the understanding of them regarding the pain and the behavior towards the pain will be more positive, and prevent maladaptive or chronic disorders to proceed, right? So if this is out of our concern, if let's say there is extreme psychological issues, then we will put them under yellow flag, then refer them for further medical intervention. So as I explained before, the cold mainly effective for nociceptive type mechanism. The heat is mainly for the nociplastic. So what's the difference between cold approach and heat approach? So cold usually be given if there is a sign of acute inflammation. Acute inflammation means when you have, if you have observed swelling with redness, with warm and pain. So when you have noticed the acute inflammation signs, it's highly advisable to give cold compress or cold application. On the other hand, if there is acute inflammation, it will be contraindicated for heat therapy. because that can worsen the condition. So our heat therapy usually be given into chronic conditions, and particularly we give to the muscles which is tight or spasm. So heat therapy will improve circulation to the muscles, improving oxygen supply and flush out all the metabolic waste like lactic acid out from the system and make the muscle more relaxed and more functional, right? So to be more specific, so let me show some of the methods and indication and contraindication. So the cold therapy you can use for 15 to 30 minutes, but here there are a few precautions you need to take into account. When you apply, every 5 minutes, you have to observe the skin, whether it's showing any discomfort or redness, because even cold can cause cold burn, right? So it's important keep monitor that. The other indication then the nociceptive is for any acute injuries. We can give for chronic pain also, but if there is acute inflammation is shown. For even post-surgical pain, when there is edema or swelling. Contraindication, we have to take a extra precaution when there's cardiac issues involvement, when there's respiratory issues involvement, if there's an open wound, if the person have a circulatory issues, if he has a cold allergy, or if the person have cold hypersensitivity and numbed skin. So these are basic precaution or contraindication you need to see. For the heat, other than the chronic, also can give, as I explained, for spasm, chronic edema, and for other related conditions. For contraindications, we need to closely monitor if he got fever, any cardiac irregularities, if you have any skin issues like diabetic neuropathy, you got any infection, active bleeding, or any acute inflammatory conditions, right? So you should have a proper knowledge and to know when to apply cold and when to apply heat. Another method, TENS. Okay, here the basic way you can apply, and you can get more information of the application in the net. But I want to talk more on the benefits. So TENS generally is a drug-free, produces endorphins, mimic massage, refrain our nerves, reduces inflammation, give little or no side effects, effective or complementary, suitable for chronic and acute, and also decreases pain signals to the brain. However, there are few contraindications and precautions we need to take, like we shouldn't give to the eyes or near the thoracic region, too near to the spinal column, or if you have noticed or history of tumor or cancer, if there's an open wound, and if it has an abnormal sensation for pregnancy women, or also sometimes when this person have high risk or epilepsy, also we have to be more precaution, if possible, contraindicate from using it. Decompression such as overhead stretch, child pose, cat-cow, with back relax and standing kitchen sink stretch. The idea of decompression is not really to open up the compressed place, but to realign the spine, and also by stretching it to relax the muscles and release some level of compression to the spine, right? And most importantly, the therapeutic intervention. There's a lot of type of interventions that we do according to the presentation of pain. But let me focus more on a relaxation type exercise, which is usually the stretching. It's mainly important to release muscle tension, have to reduce stress. By releasing the tension, you're going to get more range of motion, more flexible muscle, and better flow to the muscle tissues. So these are the few types of stretch technique that you can try at home, mainly for the neck and the shoulder, and this for the more to the spine, and this more to the low back, right? So let me see if at the end of the session, if I still have time, I will show some of the stretching technique. If not, then probably in future webinar, I will try to focus more on the exercise-based type of webinar, right? Eventually, the other types of exercises at office or at home you can utilize. The important cue is you have to keep active and active and active. And I think you understand what's so important to be active as one of the primary pain management tool. In conclusion, I believe I have cleared some of the misconceptions. The misconception that pain is always bad. It shows that pain is actually not always negative, but it's more on positive, where it gives us an early precaution for further injuries, it preventing us for further re-injury or chronic conditions, it's protecting us from causing more damages to the soft tissue. Uh, Same approach for all pain. Now we have a better understanding to apply the respective pain management tool according to specific presentation of the pain. Then movement will exacerbate pain. So I think we have a general idea that when control and easing way of movements actually will reduce even more pain rather than increase pain or causing further injuries, right? Then pain is more physical. So I think we have to understand that there's a high level of cognitive and emotional response involved. So it's very important to handle it primarily or as acute as physical intervention. Then green and buried, as I explained, the motor system, I don't think it's a good idea where you just can bear the symptoms and just go on with that. So the early intervention or early management need to be considered. So then we can avoid further injury and also reduce the chances of chronic type of pain, which is eventually will improve your performance, improve your social participation, improve further your quality of life, and of course, reduce your cost of management for chronic type of disorders. So if you have further questions or inquiries, you probably can WhatsApp me or email me, or you can just contact me through Inc, right? So I think I'm done for today. So I would like to call upon Madam Vinothini to just give us a basic information of how the motor system is affected by the work-related issues. Thanks.
Thank you so much, Mr. Murali. That was a very good presentation. I think the audience today, they might have understand, okay, they might have some basic understanding, regarding the pain. What are the causes of the pain? And also, you had helped us to avoid, to avoid the misconception that the pain is always bad. Actually, that is very true. Okay, pain is actually is early signs and symptoms that something is happening in our body. So it's like a red flags. So the moment we had a pain, that means something is wrong. So we really should go and take the intervention. So Mr. Murali, can you help me to show me the slide on the regarding the motor theory? Just that one slide.
Wait,
Yeah. Okay, yes. Thank you so much. Actually, if you see in the industry perspective, mostly if you see the workers, they will come and complain of a chronic musculoskeletal pain, which is chronic musculoskeletal disorders, and the pain is within them for quite prolonged of time. So this particular framework is actually explains very well. So when the particular individual, or we can say, the particular worker, when they have a cumulative load, when is a cumulative load, it can be a repetitive movement or repetitive exposure to the risk factors. What will happen? There will be changes in the tissue, the muscle tissue, where it lead to the muscular imbalances, and it also lead to the poor motor control and muscle fatigue. So when this particular what we say, the mechanism was happening for quite prolonged of time, that lead to the trauma to our muscles. So that's when the particular worker or individual will started to develop the symptoms of the pain. But we should understand something. Okay, from this particular theory, from this model, we understand that pain is early sign and symptom. However, we also need to understand that pain is not the early sign. Okay, the muscle fatigue and muscle discomfort, that is the early sign and symptoms. So the moment the moment or the workers started to have a muscle discomfort or muscle fatigue, we should start to take our treatment as soon as possible, so that this particular disorder will not going to become chronic or become very severe. So always try to look changes in our body. So the moment we start to feel a discomfort, after a prolong of our work or prolonged working nature, when we have some discomfort or fatigue, please try to take the treatment as fast as possible. Now we can use a lot of approaches. We can use a medication, so one of the way to relieve the symptom. But another one way is like what Mr. Murali have explained just now, self rehab, our hot pack, cold pack, trans, it also will help in a pain reduction. So Mr. Murali, there is a one question from our viewer today regarding the TENS. Okay, is TENS intervention is very effective for relieving pain? What's your opinion, Mr. Murali?
Okay, actually, I just replied to them, but let me explain it.
Yeah.
Okay, generally, TENS is for more short-term relief and is usually more effective in subacute or chronic stages, but more effective while the TENS is still on, while you feel the activation from the TENS. After you take out the TENS, there will be a short time where you feel relief of pain, but when you do the movement, abnormal movement with awkward posture, the pain will be back. So and also it's quite less effective when come to acute type of pain, because intense level of nociceptive mechanism is taking place. So approaches like cold compress will be more beneficial to bring down the painful stimulus. So here I highly recommend you can use TENS for short-term benefit, but always incorporate exercises to get a longer duration benefit.
Another thing, Mr. Murali, how to differentiate between this, this acute, chronic and chronic pain? Is there any differences in the pain intensity?
Okay, like from how we see, since pain quite subjective, and everybody will explain pain in different way. So we take that as one of the component, but we will follow the signs of inflammation. We call cardinal sign. So cardinal sign means you will have pain, you have a swelling. There's a difference between swelling and edema. Yeah. Swelling means there will be a shining surface on the skin, and when you press, it will be immediately bounce. On the other hand, when there is an edema, usually due to the fluid retention, when you press, it will slowly bounce back. So swelling means is due to acute inflammation. Then the third sign you will see is warm, if the place is warm, and the last one, if there is redness. So these are the main 4 signs that we will see, and also tenderness, some level of tenderness. So these are 5 signs we will observe and we will test, and with that we will classify. We do a preliminary classification whether it's acute or non-acute.
Okay, thank you, Mr. Murali.
But another thing, you probably can ask me for the large joints, it's quite obvious, but how about the spine? You
Yeah,
can't see the swelling in the spine.
exactly.
So there we will take into account the pain and tenderness, because when
Okay.
there is an acute inflammation, there will be a high level of tenderness around the structure. And we usually use accessory mobilization to test how aggressive the pain increase. So these are more physical way will test when involving spine segment.
And another thing I also like to add on, okay, there are different type of pain, like how you had Mr. Murli have explained just now. There also another one type of pain that that is very important for the industrials, which is the psychogenic pain. Okay, psychogenic pain is nothing about when the pain is influenced due to the anxiety, depression, and stress. So we should always remember if the person is having stress, or they might be stressed due to the job or stressed due to some other family related, they can also develop pain. Okay, so for to differentiate between this acute pain, chronic pain, the psychogenic pain, that's why the assessment comes into a very major role. So we really need to understand the causes of the pain, why the pain came. Is the pain is due to the pathological causes, or the pain is due to the psychological causes? So that's another one thing that we really have to emphasize. And another thing, Mr. Murli, last question for today for you. I mean, for the I think it will help our audience to to understand better regarding this about this pain. Mr. Murli, I mean, in what might be the red flag, like other than the cardinal signs that you had explained, what are the red flag symptoms? I mean, when the the individual need to be worried, when they should be worried that the pain is getting severe?
So there are a few aspects that we look at. Let's say if a person has severe numbness,
Okay.
either one side or both sides,
Okay.
usually due to the disc herniation or disc prolapse. Or
Okay.
secondly, we see if there's any significant weaknesses,
So that
either
means,
side or both side.
Mr. Murali, is it about the neuropathic pain that you're
Yes,
talking
more to
about now? Yeah.
neuro related symptoms.
Yeah.
And sometimes when they have they have an incontinence bladder control. So
Okay.
all these neural deficits, if let's say they have a sudden loss of weight within 3 months, if let's say they have pain more than 7 out of 10, that shows very high severe pain. So these are a few, or there's any open wound, or by history we found that he gone through an acute trauma or high intense of trauma. So with all these signs, we will recommend if we needed for red flag for further examination. Then after get a feedback from the medical perspective, we will do the further intervention.
Okay. Thank you so much, Mr. Murali. I think that it was such a very knowledgeable webinar today. I really hope all the audiences today must have learned something. Not learned, I'm sure all of us, definitely we had experiences of pain in different stages of our life. But to understand, the type of the pain, to understand the cardinal signs of the pain, and, to do a self rehab. So I think these are the new knowledges that we must have shared to our audience today. So thank you so much, Mr. Murali. We
Okay,
really
thanks a
hope
lot for
you.
having me here, and thanks a lot. Hopefully, I will do some other webinar regarding on the
Yes.
industrial. Okay, then thanks a lot.
Thank you so much, Mr. Murali, and thank you so much for everyone for being here today. Thanks again. Bye. Have a nice
Thank
and
you very
safe day.
much.
Thanks, Aja, for the arrangement.
Okay, thank you
Are you
everyone.
there?
Mr. Mori, can we take a photo session?
Okay, wait.
Can you unshare your screen?
Okay.
can everyone on the camera? Okay. I will select the photo. Okay, 1, 2, 3. Okay, one more. 1, 2, 3. Okay, thank you for everyone.
Okay, thanks a lot.
Thank you so much. Have a nice and safe
See you
day.
in
Bye.
another program. Bye.
Bye. Okay, good job, brother.
Oh, thanks a lot.
Very
So
informative.
can I log out now?
Yes.
Okay.
We will log out now. Yeah, sure.
Okay, thank you.
Bye.